We have a two-step process in our pharmaceutical, in our hospital inventories. We do the first physical inventory, scan in, like I say, enter in the drug code and then how many are there, and we will transmit that data to our laptops, and we will print out a physical audit trail of everything that we've counted, and we will go back and double check numbers, high numbers, low numbers, high dollar values. But again, it doesn't matter if it's the half-cent aspirin or the $1,000 chemo. We double check everything on the sheet to make sure we didn't miss something, but also that if we just look and verify, yeah, I agree with whoever counted this, that's the number in a vial, in a bottle, in wherever. Hospitals have automated processes that sometimes they'll come in and say, like a carousel, a machine that holds a lot of things, they've got it computerized, and sometimes we count them, sometimes we don't. They often find that the number that they thought they had isn't the number that we physically count. And so we are going in and trying to verify the numbers they have and also supply them with perhaps a new bottom line so that their ordering stays consistent. And so that's part of our physical count and our recount and our audit trail verification to make sure we are accurate, to give them accurate numbers. There is more and more automation in hospitals. We sometimes get the data from them and enter it in, and sometimes they simply tell us, you don't need to worry about that, we've got that under control. It's very important. I mean, in a lot of the bins where the medications are, they do have a minimum number and a maximum number. And there are times, there are shortages of medications going on quite a bit. There are notes in bins that'll say, don't loan this to anyone else because it's a shortage. The supply chain sometimes is really good and sometimes it's not. That goes across anything. That goes across retail, that goes across industrial, that goes across healthcare. Sometimes supply chains get interrupted. Specifically, the hurricanes that go through the Caribbean islands, there's a lot of manufacturers down there for like IV fluids. And a hurricane goes through and wipes out a factory. Suddenly, a bag of IV fluid gets in short supply. And so supply chains are subject to interruption.